Hello, everyone. My name is Michelle Goodwin, and I am the faculty director of the O'Neill Institute for National and Global Health Law, and also the O'Neill Professor for Constitutional Law and Global Health Policy at Georgetown. It is our pleasure to be with you today and to bring to you this very important program, United for Change, a Catholic response to today's global health challenges. We bring you this program out of concern and also out of a vision for change. We pay attention to the dismantling of USAID and the release of the America First Global Health Strategy in 2025. It represented a dramatic departure from decades of bipartisan U.S. leadership in global health. And this shift challenges the principles of multilateralism, international collaboration and cooperation, and values that are deeply rooted not only in what has been our U.S. sense of international cooperation, but also values deeply rooted in Catholic social teachings and a sense of social justice that's been part of the Jesuit experience that we embrace at Georgetown. Today's participants will reflect on the church's global mission grounded in solidarity and inherent dignity of every person. We will discuss the opportunity to strengthen our collective responses as Catholic institutions and what this moment means domestically and abroad. Joining me today for this webinar are Sister Mary Haddad. She is the president and chief executive officer of the Catholic Health Association of the United States. I'm also joined by Nakatha Njeru, who's the chief executive officer of African Christian Health Association's platform. And rounding out the panelists joining us today is John Monahan. He's the senior advisor to Georgetown University's Global Health Institute. He's a professor in the Department of Medicine, a senior lecturer at Georgetown Law, and a senior fellow with the McCourt School of Public Policy. And he has been a long-standing member of our O'Neill community. Before we begin, I want to just level set and we'll ask Sister Mary our first question. And this relates to a statement that was issued on the morality of U.S. foreign policy. Cardinals Kupich, McElroy, and Tobin, citing Pope Leo, giving direction for diplomats and expressing concerns about the status of morality in U.S. foreign policy. And this is a statement that was just released maybe a week and a half ago. And so, Sister Mary, I'd like to ask you first to perhaps respond to this. It's kind of ironic that we have this webinar, which we had planned for some months ago, and right before it, this statement issued by these cardinals.
Yes, thank you first for inviting me to join this group this morning. I think it's God's timing, right? That the voices of leadership in the church are speaking out. So this comes right on the cusp of following the special consistory that Pope Leo had called, that our three cardinals issued this statement and called all of us. And so I was very proud of that moment when, that was released and it called for attention, that it is a moral crisis right now. And I think that when we look at the global church, this is what we're called to do, right? To be able to be that prophetic voice and to raise up the gospel message at a time when our society, in our world, falls short of that. And so that's what Cardinals Cupich, McElroy, and Tobin did. They called us to the very fact of who we are and what we should be about. So in many ways, it didn't surprise me that they came out with this. And I know the USCCB also stands behind that, the United States Conference of Catholic Bishops, in this work. So I was very pleased. I think this morning something came out that Secretary of State Cardinal Parolin has come out with statements as well, particularly around issues of this administration. So it pleases me to see the church giving voice to the challenges that we're experiencing today.
So well stated. And in fact, just to pull from thoughts offered by Cardinal McElroy, offered the following thoughts that Catholic social teaching testifies that when national interest narrowly conceived excludes the moral imperative of solidarity amongst nations and the dignity of the human person, it brings immense suffering to the world and a catastrophic assault on the just peace that benefits every nation and is the will of God. And he further noted in our current national debate about the fundamental contours of American foreign policy, we ignore this reality at the cost of our nation's, our country's truest interest and the best traditions of this land that we love. I'm wondering how that resonates with you, Sister Mary.
Well, it hits at the heart of who we are, right? So I think what they're speaking to is our ability to ensure that our values in Catholic social teaching are embodied in all that we do. So they're calling us to that, right? So the common good, the dignity of people, subsidiarity, solidarity, those are all elements of our faith tradition, and they are embodied in all our ministries. And so I think this is what it's about, calling us to that, and that we're authentically Catholic, if you will, universal. And so it is imperative that we, live out that reality. I think I was struck, and I believe it was Cardinal Cupich. Maybe he had spoke about this in an interview, but somewhere I had seen it. He talked about this diminishment of our global safety net. And I liken it to the similar experience that we have here in Catholic healthcare in this country when we see cuts in Medicaid, that it is the very safety net of the people of this country who are most in need that are punished, right? That they're affected. So he's taken that same perspective and has put it on the global reality of the diminishment of USAID and funding to the global health issues that really are impacting our global safety net.
So, why don't I turn now to just level set amongst our panelists? Thank you so much for that. And I want to start with you, Sister Mary, and then I'll be following up with Nakatha and John. And that is to ask you about the work that is done at the Catholic Health Association. How are people to understand that work who might not be familiar?
So let me start by saying we are the Catholic Health Association of the United States. So we focus certainly on Catholic health care that's delivered within the borders of the US. But because we're a ministry of the church, we are also responsible for the global issues and the global health. I leave for Rome on Sunday for the very thing of having conversations about our work. We have a connection to the broader church. So our ministries in the US are doing a variety of different activities in order to support global health in other countries. So let me start by saying that. Go back to Catholic social teaching. I would say that that is really, for lack of a better word, I'll use more of a corporate language, the operating principles in which we, build our ministries in healthcare. And so we do a lot of work in formation, education, development. So our leaders are able to make decisions based on those principles, provide services that are based on those principles, and to hold accountabilities based on those principles. So it really is through that lens of Catholic social teaching that we do our work. And I think it's important. I'm going to say very personally, I'm a social worker by training, and I worked in Central America in my early days. And some of the best learnings for me is really the understanding of how we approach service in another country and anyone who is marginalized, that the recognition that we are not the savior, We are not coming in telling people what to do. We recognize our own cultural arrogance, that we are one with people and we help provide the resources. They know what they need to do, but we help provide the resources in order for them to be able to do it. So I think it's what I like to believe it's our approach to this service that shapes what is actually able to be delivered. So just a few comments around
That's
that. I'm sure
actually
that
critically important. And we'll come back to that approach, because it makes a big difference whether it is actually inculcated in the culture and coming ground up, or whether it's parachuting down. And you're making very clear that the effort is not to parachute down. And I appreciate that. I'm going to come back to this. Let me turn to you, Nakatha, because you're the CEO of African Christian Health Association, and it's a platform. And if you could just give us a sense about this platform and what it is that you all do.
Yeah, thank you very much. And I'm very happy to be on this panel tonight. It is nighttime here in Nairobi. Um, the Africa Christian Health Association's platform is really the largest faith-based health system on the continent, convening Christian health associations who, in their definition nationally, is the collection of the mission health facilities in different countries. We are present in 32 countries in sub-Saharan Africa, bringing together more than 10,000 health facilities. And so, um, by how we are, how healthcare is in Africa, the faith communities tend to be the ones that are serving the most underserved and poor communities in most of Africa. And so we work as a platform then to make sure that we bring together um, um, the people that are serving these communities. We ensure that we equip them to do the work they do. We connect them to resources, to partnerships, as well as amplify the work they do. And one of the things that is very prominent in most of the countries in Africa is that faith-based health facilities or faith-based health systems do not have support from the public health coffers. So we have to fundraise for the work that we do. And part of that fundraising has been from many of the agencies that have been providing funding to organizations like ours that have been providing services to the remotest of areas and the underserved communities in most countries. So and in some countries, we actually offer up to 70% of the healthcare in those countries. Yeah.
So that basically, without you and the work that your organization does, there would be limited access to healthcare. And we'll talk
Very
about
true.
that. So, John, let me wrap up this first question, then we're going to dive right on in, which is if you could help to elevate a bit about Georgetown's mission towards health.
Sure. No, thanks, Michelle, and thanks to the rest of our panelists. This has been I'm looking forward to this conversation. I think, as many of you know, Georgetown is the oldest Jesuit Catholic university in the United States. Our mission around education and research and service cuts across a broad variety of domains, but health has been central for many years, and including health, obviously, domestically, we do health professions training. We've been involved in service delivery in our nation's capital, to work that we do supporting countries and partnering with faith-based organizations in low and middle income countries around the world, particularly focused on HIV, but across a range of areas. In all that work, we try to integrate both opportunities for learning, but also service and generating new knowledge. I would just say the things we have. I get happy to talk about our structure, but I think the ideas that both Nkatha and Sister Mary reference, I think, are central to why we do this work. One is Catholic social teaching animates the whole purpose of this university, at least in my experience. And there's no more powerful area than in health, because that is an opportunity to relieve suffering and make a difference in people's lives. But how you do it matters. Among as we talked as a discussion about partnership is vital. This is not about it cannot and should not be about a North American university parachuting in and doing things. It's about, I think the Jesuit idea of accompaniment, which I think resonates quite well with what we talked about here in partnership, which is how can we, with the resources, experience, privilege, if you will, that we have, be a resource to others making a difference in their communities. And I think that that notion of partnership combined with our Jesuit Catholic heritage animates what we do in health, whether you're talking about work that we're doing here in the nation's capital or we're doing globally. So that's who we are. And we, of course, we partnered with many of the people on this call, but particularly Catholic Health Association. I must give a shout out to Sister Mary. I've been honored to be on the global committee of her organization for many years. I've partnered with a number of people over the years on both domestic and global issues, and the church's prophetic voice is very important. So thank you.
Thank you, John. So now that we've got that level setting out of the way, I'm going to dive in with some statistics, Sister Mary, and seeking your response to this, so that our audience comes away with a deeper understanding. And one of the issues that we'll touch on is Medicaid and what's taking place there. But here's what we know, that external health aid to low and middle income countries is projected to drop 30 to 40%, or that it did in 2025. And that's compared with just a couple years before. Um, those areas that are affected by that include maternal care, vaccination programs, emergency preparedness, disease surveillance, and more. And the impact in some countries may be up to 70%. Sister Mary, how do we wrap our minds around just what this means in terms of the U.S. foreign aid policy pulling back and the effects such as that in countries that most need support and previously had support from the United States?
I'm going to start by saying I think we have to remember what happened during COVID, right? So, as we were all feeling our own sense of isolationism, that it was actually a global pandemic, that what happened in another country has an impact on the US. And so, I think for us in this country, we have to change our mindset and understanding that we are interdependent. We are not independent countries. And so whatever happens elsewhere is going to have an impact on us. And certainly that as we see the death rates because of lack of funding to, ensure vaccines, preventable diseases, it will eventually, as John was talking about, it's who we are in terms of our response in Catholic social teaching, but it will have an impact on the United States. If you want to take out the compassionate response and look at it more from a structural element of this, it will. And so it is morally reprehensible that, our country is not only doing it to other countries, right, in diminishment of aid, but we're doing it right here in the United States when we're seeing people who don't have access to affordable quality health care. So we're going to replicate exactly what we're experiencing right now in other countries. We're going to see it here in the United States. And I don't believe that there's going to be significant change until there's a recognition among the public in the US of what is happening here. So I don't want to get too political about this, but it is a political issue.
It is a political. How do we avoid seeing the politics of it? I mean, this results from executive orders. This results from Congress not stepping in. I mean, it's hard. It's hard to avoid saying that it's a political issue when it's come from the political landscape. John, I'd love to pick this up with you because what Sister Mary is saying is that we are a united space, and COVID is the perfect example of it. We know that deaths will result. We're looking at somewhere between 500,000 to a million additional deaths just because of policies or policy changes that we see in the last year. How does one wrap one's mind around that?
Well, I don't think we should be able to wrap our mind around that. I think it's overwhelming and it's challenging. And what it means is I think it's both a this kind of reduction in support for health, whether you're talking about Medicaid in the United States or we're talking about foreign assistance, is it's both morally problematic, but it's strategically problematic. And yes, it is political, but politics is not just about speaking your own sort of moral frame. It's about finding partners. It's about finding allies. I think one of the things that the church or the Catholic Church has been effective at over the years, both domestically and globally, is being in partnership with people. I just know from my own personal experience, the work around Obamacare and the expansion of coverage and the Obama administration, the Catholic Church, the Catholic Health Association was an indispensable partner in that process. The Catholic Church, other faith-based organizations, the foreign aid that we're talking about, it's really grew dramatically in the last 25 years. The PEPFAR program, the President's Emergency Plan for AIDS Relief, the President's Malaria Initiative, the wide range expansion of global health. That was because, in great part, faith organizations partnered often with groups that they disagreed with on many other issues to lift up these voices and expand our vision. So my point at the beginning isn't, it is very, when I say it's hard to get our head around it, it is overwhelming. The question then is, okay, what do we know from what has worked? I think it is to build a broad coalition of people that can agree around the basics. I think as Sister Mary was saying, it is both not smart and it is not right to reduce aid. So now the question is, all right, given that, what do we do? And
And
I think
John,
we can
just
talk
before
about
we
this.
get yeah, and just before we get to the what do we do to just help to give greater perspective to people understanding what's taken place. Um, we know that the U.S. support in the domain of development assistance for health was at $80 billion in 2021. And in 2025, that fell to 39 billion. That's a 51% decrease. Sister Mary has reminded us that, those matters come back home.
Sure.
Um, and if current trends continue, then we can look at that development assistance for health as further decreasing in this year and then the years to come. And when I think about that, right, that's not insignificant. I mean, truly. And you mentioned PEPFAR and the U.S. Effort to try to address HIV and AIDS in countries around the world, and the humanity that was spared by that, the lives that were saved. And then you also mentioned the Affordable Care Act and working on that and how that is indispensable for so crucial for so many Americans. I'm wondering how we tie all of this together, right? And I think Sister Mary was hinting at it that, it's not just abroad that we have to be concerned. It's also what's taking shape here in the United States. And for people who are low income or who may be middle class, but still suffering because they can't afford healthcare and safety nets are being rolled up. I'm
Michelle,
wondering if you can respond to that.
well, I have long believed global health isn't health over there. It is health. The United States is part of the world. And as Sister Mary alluded to, and as we learn from COVID, and as we learn every day, if we step back and just look at outbreaks around the world, there's there's no mechanism that where you can build up walls around a country for whether it's infectious diseases or other threats. Even if you wanted to, they wouldn't be effective. So there's both a practical and a moral reason to think of health more broadly. And to the point about Catholic social teaching, it's not just about how systems operate for the population at large, whether you're talking about the United States or other countries. It's with a special focus on the people who are most likely to be vulnerable or to suffer or to not have access to care. And I think there are a lot of actors that are going to have to be involved in the political response, whether you're in the United States or you're at international level or you're in countries that are working to respond to the situation quite clearly articulated that are going on country by country. Low and middle income countries are dealing with this dramatic change in the donor landscape. But in each one of these places, there is a role, at least in my life experience, for the moral voice that's grounded in service delivery and engagement with communities that have been left out and left behind. And the Catholic Church is among them, and I think it has done a great job at its best of partnering with other faith organizations and being a voice for people who are left out, and also being a wise voice from experience in the delivery of care. And I would defer to Ankatha and Sister Mary, because they're the ones that actually do the work of delivery. But that's an important voice in every country for how health policy is shaped and where we're going forward. Don't get me wrong, Michelle, this is a crisis, but we kind of have to remember where their strengths lie and the various organizations here. And I think this is the right time to have this conversation.
It's such a critically important time. So before we turn to how we pivot and what does that pivoting look like aligned with Catholic values, Nakatha, I would love for you to, and really appreciate your helping us to understand what this global change, this shift means on the continent of Africa. And I mentioned continent specifically because so often Africa is conflated as a nation, whereas it's over 50 countries, each with its unique identities, language, policies, et cetera. But how have this sort of nature of these cuts affected healthcare on the ground in parts of Africa that you serve?
Thanks, Michelle, for that question. I think to just bring it home, um, there is a woman living below $1 a day and has to make a choice between putting food on the table for her children or providing a vaccine for one of her infants. And she has to make a choice. She has probably 5 children who need to feed on this dollar, or a child who needs a vaccination that she does probably not well understand its importance. And so those are some of the choices that families are having to make on the continent. I already talked about the faith sector and said that many of the faith and private health systems in African countries do not have support from any other sources. And so they have to pay their health workers, they have to deliver services, and they exist in places that are hard to reach. There's fragility, it's probably a war zone. The government is not able to reach that place. And so they're the only people that are in that place. And when they do not have the resources, then they have to decide to prioritize what service will we give and what service will we not give. And so health workers have had to be cut. And cutting health workers means, cutting the number of health workers means you have less hands to do the work in these facilities that already had a stretched health workforce. It also means that some of the things that we have been working on, like thinking about pandemic preparedness, are no longer prioritized. And like John just said, global health is not health on the African continent. It's really global health. And by mentioning some of these things, therefore, I'm sure we all get it that if a child in Africa is not immunized, then we are all not safe. If healthcare is not being provided to people in a certain region in Africa, it is going to affect all of us. And of course, there are other issues around the fact that we are currently on the continent discussing the issues around the government to the global health strategy of the US government. And there's a lot of emphasis on the government's taking responsibility, which we all agree is a very good thing, because healthcare really is the preserve of is the responsibility of the government. However, we need to work in ways that are practical, catalytic, and that are going to lead all of us towards a predictable future. When we say we are going to do this in 5 years, what have we put in place to make sure that in 5 years' time, Kenya, Niger, Uganda, who are in various stages of developing their health system, are able to take care of this? What have we looked at the politics of those different countries and how it affects healthcare? In many ways, then those are some of the things that we are thinking really have. Those are some of the challenges really that we are having to deal with. Though we appreciate the fact that it is time that we all think about sustainability of healthcare, but in ways that are not going to leave catastrophic consequences to the poorest of the people that we, especially the church, are serving. And we are therefore the hardest hit in that case.
I'm wondering, to follow up before I turn to the question of pivoting, and maybe this is the soft transition to that, with U.S. aid being diminished over this past year and in years to come, it looks like. What other resources have come within view? Have you seen that European countries have further stepped in? Asian countries? What's been the landscape there?
I think the US was boldly doing what everybody else has been doing quietly. So everybody's cutting on funding for various reasons. I'm sure you've heard about most of Europe is doing it and putting money in their defense budgets. The foundations are now stretched because everybody's turning to the foundations. Some of the good things that are happening is that the church is starting to look inwardly, even on the continent, and we're starting to think about what resources do we have. I know that's going into the pivoting. What resources do we have? How have we worked before? What can we leverage? What do we need to bring back? Is it our prevention services so that then we do not get into the place we are right now? So the short answer is everything is going down in terms of funding. I can't think of places where we can say this is where we are going to turn to confidently.
That's heartbreaking. So, Sister Mary, we've level set. We've we understand just how dire this is in terms of lives that uh, will be lost, have been lost, the financial cuts, the fact that resources are pivoting into defense and military budgets rather than advancing people's health. How does one, what do you see as the pivot out of this for Catholic health?
Well, I just love the conversation and what's going on. It takes everything from me not to unmute to chime in on comments. So again, thank you for this engagement. I'm going to start by saying there's no good crisis that's left, without a learning. What are we learning through all this? And I would venture to say that we have approached global aid as an act of charity, that we will give out of our abundance. And so when we start feeling pressures and financial pressures and cuts, and we have CEOs that are having to close hospitals and pull back services and cut staff, they feel the crunch. And my biggest concern is, are they going to feel that they can't give out of their abundance anymore to global needs? I think it's an issue. So what it says to me is we've got to change the framework here. We have to look at creating sustainable models of care, not only in the US, but globally. It's a justice issue. And so it's that approach. We've heard, how do we work with, folks locally in order to create something that is sustainable instead of just giving, amounts here and there that we're trying to figure out what happens when the well runs dry. And I remember years ago when I was working in Belize, they would say to me, the biggest concern the people have in that country is not that people come to help, it's when they leave. So we have to consider the need for stability when we help create a system and then we abandon people. So John was talking about accompaniment. This is exactly, what Pope Francis was saying. So I do think this notion of sustainability, and I will say after COVID, our CHA board went through a process of articulating a new vision statement for the organization. And we said that we will empower bold change to elevate human flourishing. That's a statement that can be applicable all over the world, right? What are we going to do? And in that, of course, we have several goals, but one of the goals is United for Change. We have to break out of our mindset that we have the abilities to do this on our own and we don't need anybody else. That we have to collaborate with not just Catholic organizations, not just faith-based organizations, but all organizations of goodwill who want to work in, addressing these critical issues in our world. So I think my response to that, Michelle, is we've got to look back and say, how do we change the structure for, global support? Because what has perhaps worked in the past is not going to be sustainable for the long term.
I really appreciate that. And I might even ask, unmute if you need to, because sometimes I call it the double-fisted intervention where you just need to put it out there. But this point that you make about collaboration and cooperation being beyond the Catholic sphere, and that is critical. The sense of being united and not isolated within the space is critical. And so, Nakasa, I want to turn to you then in asking, based on that, then what are the needs? What would you articulate as being the kind of collaboration and cooperation that you see as being vital on the continent of Africa and in the countries that you are working with? What does that look like in
Yeah, thank you,
application?
Michelle. I think true to what Sister Mary is saying, how we partner going forward is just as important as what we put on the table in terms of resources. And I think partnerships for the future will need to think about what do we want to achieve. We'll need to look at sustainability and I think we have talked about localizing, local ownership, but I think it's time that we are very deliberate about what is localizing, what is local ownership, who is this that we want to engage, how do we want to engage, what are the real priorities of the people that we want to serve, all of us as Christians, and we have to listen to them as the people that we are serving. And of course, some of the things that I have seen that are good, that are coming out of this situation is that there's more deliberate engagement between us as faith communities to ensure that we cover ground. We are listening to each other more. We are starting to not want to be fragmented. And I think in the past year, I have talked to more people of faith or organizations of faith than I have before, because I think now we have been called to order. God has put it in our place now to want to work with each other better than we did before. We want to know who's working where, what are they doing, and is there a gap? If there is none, I need to move and cover the next place. So I feel like we will have better efficiency and effectiveness in the work we do if we continue to do that and ensure that we are partnering better, we are listening to each other, we are listening to the people that we serve, we are talking truth to power. And that is something that we, especially on the continent, culturally, is not something that people do a lot, but I have seen faith leaders are now starting to rise to the occasion. We are talking to our faith, with the faith-based health system, are starting to talk to our faith leaders and work together. Because before, what I saw us do is that those of us that are doing the faith work of the church continue to do what we do, and the faith leaders continued with evangelizing in other ways. But now we are having to sit on the same table and talk to each other because we realize that we are all evangelizing using our different ways. So I think partnership, that is people talking to each other, realizing that we are trusted. We have rooted, we have deep roots in our communities that we need to engage. We have the moral authority and making sure that we use those. I think that's how I see partnership going.
I'm going to take a moment to ask those who've joined us if they have questions to put those questions in the chat, and I promise to try to get to a couple of them before we wrap up. Sister Mary, I want to come back to you, and then we'll go to John as we begin to wrap up. And I'm wondering your thoughts about is this a time in which organizations that might have been, I won't say silent, but perhaps doing the work and not necessarily feeling that they have to make press statements. Is this the time? Is the urgency now somewhat of what John was saying, where in fact speaking up, speaking out, strategizing requires something different than what was before? And here I'm
Yeah,
speaking specifically to religious-based organizations.
yeah, I think it is imperative that we look at my fear again is that we get so um, um, focused on what is happening here in our own country that we're going to be blindsided to the larger reality. We're all interrelated, and we know that. We have to recognize that we don't live in isolation. So it is our responsibility to go broader. And I think that this is where faith-based organizations have a particular role of being leaders in this space, because we do this work not because we're well paid. We do this work because of what we believe. And if our belief is truly, impels us to act, then now is the time. I mean, this is what we call, prophets of the day, right? To rise up when society is really not in line with the gospel message. And it's imperative that our faith-based organizations be that moral voice in our countries right now in order to call us to you know, our better selves. And
Mhm.
so it is time. And I think we have to be very careful how we message this, because we know we're at a time of great polarization, some say tribalization in our country, where we need to help shape the perspective of the greater good, the common good, and to recognize that it's just not within the confines of the U.S.
Well, I really appreciate your mentioning that. As you're talking about values and are being honest with it, you mentioned Medicaid. Medicaid came out of a civil rights movement. There was a medical civil rights movement. President Johnson signs Medicare, Medicaid into law right after the 1964 Civil Rights Act and 1965 Voting Rights Act. That these were hard fought for rights to make sure that people would be treated with human dignity when they sought health care. To reflect on just what you were saying, we had a time in our country where if you were Black, you could be turned away from medical care, even if you were dying on the front steps of a hospital. What Medicare and Medicaid did was to make sure, through various policies with it, that that could not happen, that we couldn't have segregated hospitals, that people couldn't be turned away because of what their ethnicity was. I think remembering the spirit behind that is so critically important. And I really appreciate what you're saying in terms of the boldness that is necessary at this time and remembering that.
And Michelle, if I may add that also during
Please.
that time, it was women religious who were calling that to question, right? So
That's
during the
right.
time of segregation, they were running these hospitals and they were bringing people in the middle of the night, people of color,
Yep.
in order to provide the care that was necessary. They started breaking down those barriers and they were very bold in their actions. So I like to believe that this is what we're being called to do today. And similar type of way to call out the injustices in our society that are actually creating, more barriers to people and their ability to live fully.
Well, and with that, with your mentioning women, just what this crisis means for their families, that this is a reproductive freedom, reproductive justice issues when we see children lacking basic health care access and services, being turned away from vaccination, all of those things. Oh my goodness. A couple of questions that have come in for us. And John, I'll turn to you on this, especially given background in law. This question: compassion is a valid reason to provide U.S. assistance, but very few voices are saying this is a legitimate and sufficient reason, even among defenders of global health assistance. How can we amplify this concept in the halls of power? And what a brilliant question for the person who raised this. Um, so often there's this thought that law is something that is tough and hard, and that compassion, love, those things are soft and mushy. We should not be driven by those things, but instead by text, instead by things that are hard. John, how do you respond to this question saying that compassion is a valid reason for providing U.S. assistance?
Well, I would say, of course it is. And the U.S. government's foreign assistance at its best has been a reflection of the moral values of the country, including values like compassion. I would also say, though, and I don't mean this to diminish in any way the centrality or singularity that compassion or other prophetic voices like Sister Mary and Kantha have been articulating. But I do think we have to think about what is the broadest coalition. A little bit, this is a little bit of Sister Mary's frame, except globally. I think we have to realize that the coalition that supported development assistance and global health historically, we've at least hit a very deep bump in the road, and I don't think we're going back. So I would argue, yes, compassion should be singular and should be the reason people vote and engage in the political process in this country that shapes our international assistance. But I would urge us to think in coalition. So when I think of a U.S. global health policy, it's both smart and just. It's both, a little hard-headed, but also compassionate. We can, in fact, do both. In fact, at its best, we can make the argument at, that saving lives is a value in and of itself, a preeminent value, but it's also smart to invest in health systems that will make Americans safer, that will engage our constituencies, including businesses, in the work of the future. Those are not. I just am urging us not. I'm urging us to think of a broader coalition and to think that there are ways to pursue this work that brings more people to the table rather than fewer.
I think that that was part of the point that Sister Mary
Yep.
was making in this question about compassion is a very interesting one, because when you think about, again, this moment that we were talking about, the civil rights movement, what was being called upon, I think, by so many who were involved in those struggles, was to be reminded about people's humanity. And that's all, I think, also what makes this time so heart-wrenching in so many ways, because we understand, we know these statistics. We have the benefit now of technology to be able to see the suffering that people have. We see it through video, through photograph, and so forth. And when it is that U.S. foreign policy seems to show no regard for those lives, I think that that's when it becomes very difficult to figure these matters out, or figure out why exactly it is that there is such a lack of compassion. Um, Before I get to the next question, one of the things that comes to mind from what Sister Mary was saying, the Kathy and you, John, I can't help but think about how people see their neighbors. Is ultimately, right, some of this, even right in the United States, is how people view the people right next door. And if they prioritize that only for themselves and their family, should they be okay, but can turn the back on their neighbor. It seems to me that we're in somewhat of a zone there. And I just want to open it to the panel if anybody has any comment or reflection on that, because I think that's part of what is a problem that we see right now.
Yeah, I'll jump in here. I do think, who is my neighbor? The call that Jesus puts out in, the start of the Good Samaritan. And I remember, I sound like a broken record going back to COVID, but CHA had printed masks early on saying, love thy neighbor. The reason we wore it, not for ourselves, but we wouldn't infect somebody else, right? So again, the change of that mindset. So I think we have seen, changes in our society and how we relate with neighbor. And that has devolved actually over the years on a whole host of reasons. But at the heart of that is the gospel call, again, is, how we respond to compassionate care to one's neighbor. And that sense of neighbors very broad. As John was talking in response to that question, if I may, I just read this yesterday, and it was in recognition of the death day of Thomas Merton. And he had a quote, and he said, I would rather feel compassion than know the meaning of it. I would hope to act with compassion without thinking of personal gain. So the question is, are we only compassionate when we feel good about doing it? And what compassion is strong love is calling us to. So I appreciate the question, whoever put that in the chat about compassion.
Next question, and I'll send this to you, Sister Mary. So the person who wrote this says that the position of the speaker seems to be that it is the duty of the government to ensure access to health care. This may be fair, but it is not clear that most governments are willing to take on this responsibility. So how do we as Catholics support Catholic healthcare with our specific understanding of the dignity of the human person? And that really seems like two questions, but with the first part really being, is it the duty and responsibility of the government to ensure access to healthcare? And with this, I just want to say that we have some level setting too in part of this, right? Governments that have also played a role in enslavement, United States and Jim Crow, and colonialism, to further add to the texture of the question and also the sense of responsibility. So, Sister Mary, how do you respond to a question like that?
I'll start by saying we the people. The government exists for people. And that is really, so if you want to take it to healthcare, I do believe that the government has a responsibility to ensure that all have access. Not saying they have to deliver it and they have to provide it, but they have to ensure that it happens. That's why government exists, to care for and protect and ensure that people are able to live fully. Go back to our founding documents. And as we look towards celebrating 250 years, it's foundational to who we are.
Very powerful response. And Katha, I think that this third question fits so well, given the work that you do and what we've talked about. In the face of growing fragmentation, how are faith-based groups creating social connection or tissue through interfaith approaches? And your organization works in an interfaith way. So how do you manage that? Because it's also not Catholic specific, but there are other religious organizations that cohere under the umbrella of what you do.
Thanks, Michelle. I think that's one of the things that has been one of our greatest challenges this past year and this year, that we need to be seen as a body of Christ, all of us that are doing this work and who serve the sick, serve and care for the sick as our mission. So what we are encouraging our country teams to do is to initiate discussions with everybody who's in the country, interfaith. So we have interfaith coalitions in the country. So be it the Muslims, be it the Christians, we are trying to create networks that bring people together. And it's even more necessary now that we need to be one voice to the government. So deliberate engagements with each other and trying to cover ground as faith actors together so that we are able to cover as much as we can. And also just like I had said earlier, not just looking at us who are working in the faith-based health system, but looking at others who are working in other areas of the community, people working in education, people working in the justice systems, so that we all can come together and think of ways of covering ground now that the new normal, it's not going to be the same again. And so we have all to come together and try to cover ground. So that for me is what I see, that we can no longer be quiet doing our work as we've always done it in our little corners. Everybody has to try and reach out to somebody else where they are. And we are
Sister
actually
Mary,
being challenged.
I'm sorry, Nakatha.
No, I was saying we are actually being challenged even by our own governments to
Mhm.
come to the table as one so that we are able to engage.
Sister Mary, I'm wondering about that question for you too. What that means from CHA and interfaith alliances. It may be something that has already been part of what it is that you do, because you were mentioning earlier that you've seen and worked on these spaces where you say, okay, we have to come together and see where we align to move issues further. And I think COVID was perhaps one of those examples.
Yes, we have it locally, certainly with our ministries in the local diocese and working with other faith-based coalitions and the churches as well as we do nationally. Our staff is involved in a variety of different coalitions with other faith-based providers and how to advance our missions. And we, work together, always seeking the common ground, and be able to articulate that, we're about the same thing, and how do we break down those barriers to work collectively. So I know Bruce Compton, who heads up global health at the Catholic Health Association. He's involved in many, many various coalitions, both nationally and internationally, in order to advance that work. And I want to put a plug in and just to say, for any of those that have further questions around specific activities of what CHA does, really would encourage you to reach out to Bruce, and you can get his contact information on our website. So I want to put that plug out, Michelle.
Thank you so much, Sister Mary. All right, now open this one up to the panel, and the question. I'm going to condense it just a bit. Uh, Dr. Bill uh, Foyga's recent passing reminds us that global health is not just strategy; it is a moral duty. And his smallpox eradication leadership, grounded in humility and his call to, quote, be good ancestors, showed how justice-focused global solidarity can save millions of lives. And he served at the CDC's Epidemic Intelligence Services, which was a government-funded program that trains disease detectives and deploys them to outbreaks around the world, and so much more. All of this work would not have been possible without U.S. funding, including what was his early work. So, given that this could not have been funded without U.S. support, how should that legacy prompt the United States to embrace a more just, compassionate, and globally engaged health policy that protects the most vulnerable? And it seems that members of our audience keep coming back to compassion as being critically important. I'll open that up to the panel.
Well, maybe I can start, Michelle. As I had the honor to work with Bill Foege when he was at HHS in his last tenure during when I this is I hate 30 plus years ago when I was there, but he is an example of someone who embodied obviously medical and technical scientific knowledge of world-class stature with a moral focus that was extraordinary and unparalleled. And his passing is something I think we can all learn from. And because his legacy is so deep and broad. But I would say I, I guess, and I don't mean to be the contrarian here because I do think the I think there is no substitute for moral voices in our country. The problem is speaking to compassion and the value of compassion in and of itself. Because, the truth is there are other voices. And if the voices of compassion and love and thinking of the other are crowded out, I can assure you other voices will have their way. They will fill that vacuum. So I want people to speak, and I think it's important. And we've seen the value of faith communities speaking about compassion and the power of it, whether it's the Affordable Care Act or it's the role of CDC. It's the investing. I mean, the other part of the Foege legacy is a lot of the work that he did, a lot of the money that CDC spent wasn't something that paid off tomorrow or the next day or the next month. It was years down the road. So moral leadership, I think, is about not only the transaction, which is so much of what we see in the spirit of the current administration. What kind of bilateral government to government deal has a benefit for both sides in the very near term? It is thinking longer. So I agree, but I also want to temper it with I do think coalitions matter. And so a compassionate voice also needs to partner with other people who may have other reasons but share the same goal. And that's the challenge. And frankly, Sister Mary and Nakatha are the experts in this space, but I've seen the church and especially the health community has done that for many years, globally and domestically.
In fact,
Michelle,
Sister Mary, would you like?
yeah,
Yeah,
may I just add this comment?
please.
And it's something that I've was very powerful in shaping my perspective. And this is I'm a sister of mercy. And I remember probably 20, 30 years ago being in a large gathering, and one of our sisters from Guyana and I were speaking. And she said to me, she mentioned something about what was happening in the US. And I looked at her like I was curious that she knew it. And she said, you have to understand there's not a day that goes by that I don't know what's happening in the United States. And I stopped and I called myself to the same and thought, do I know what's happening in Guyana? And so I think we have to approach this if we don't want to say we're doing it because all this love and compassion, we're doing it out of respect. And how do we incorporate into our perspective, the experience of people in, beyond the US because of human dignity and who we are as brothers and sisters. So just a good lesson for me many, many years ago of trying to broaden that perspective and out of respect for another.
That's really quite profound. And I think we see various examples of that over time in the United States and elsewhere, where there has been the benefit of not having to know, not having to think about as the kind of navel gazing and exceptionalism. But you make a critical point, which is that it's not that's it on the surface, but behind that is a connected world. What does happen elsewhere has its effect in the United States, and also what happens elsewhere oftentimes is providing some benefit in the United States, whether it's been where the bananas come from and political issues in those spaces or other things, right? People in the United States perhaps have been spared knowing about what their fingerprints are also on some of the conditions in the world. And if we're to be honest and have a more robust conversation, then that clearly must come to the table. Nakatha, there is a question specific to you. And then after this, we'll begin to wrap up. Our time has gone by much too quickly. The United States assistance is now being made directly contingent on countries providing access to minerals for U.S. companies. Nakatha, how is this perceived in African communities, and could it be lead to resentment? Does the U.S. lose its moral stature by doing this?
Yes, Michelle, it's definitely I've heard people say it's selfish. It doesn't put people at the center of it when it has to be pegged on gold or oil in a country, and doesn't look at the people that need the care. And I know I'll push that a little bit further, because I know people have asked, for how long will Africa depend on aid? And really, I do not think that Africa needs aid. Africa needs support to get out of the global inequalities that have been there. There have been unfinished transactions that have led countries to where they are. So if we are supporting people in ways that are catalytic, that are worked on in such a way that they are looking at, where do we want to go? What timelines do we need to get this country to where they need to be? How much resources do we need? For how much time? What are the timelines? What are the things that we need to do to get them to where the United States is? So it's not being perceived in many places. People are feeling like it's feeling selfish in many places. Yeah.
As we begin to wrap up, and there are a couple more questions in the queue, and I really appreciate those who have put them in the queue. Thank you so much for attending today. I'll try to wrap up this final question with keeping a couple of them in mind, which is that I'd love to hear from each of you today about what you see as a potential silver lining that comes forward out of this very troubling and challenging time. It could all seem just simply dire. But if we're thinking about how we pivot, how we move forward, what does that look like? And do you even see some room with this administration in terms of pivoting and moving forward? Or is the work to be more localized, working with states and state governments, or working directly with NGOs and civil society organizations? How do we get to the silver lining, and what does it look like? And I'll start with you, John. I'll go with Nakatha and then conclude with you, Sister Mary.
Thanks, Michelle. I think, it's really important for faith communities and all of the allies to be prophetic voices and document the real human impacts, the stories of what has happened so far, and where some of the negative impacts of the changes in aid and support. So I grant you that. But I think your question is right about opportunities. So a couple practical things. I think if you step back and you look at the the administration's proposal for transition of programs to countries. Is that a good idea? I think there is some important ideas there. I think we all would like to see greater localization, more leadership, more funding, more resources with the governments that are serving their citizens. And in the what we've seen, and this is consistent with other policy initiatives of the administration, there's been a lot of talk and a lot of noise, but the details are here to come. So the future of negotiating, even that we've had several memorandums of understanding between governments in the United States, but the details are all out there. So a question for those of us is, how can we support our partners in countries that are negotiating with the United States to make the best of what is going to be a challenging, but potentially there's some opportunities there. Same question about our own appropriations process. I'll be honest with you, I did not expect the appropriations bills in the House and Senate to have as much funding for global health as they're in the bill. Of course, nothing's signed, nothing's done, but there's a moment here. But we've learned, and if we're smart, part of this is being clear-eyed as well as being hopeful. Clear-eyed that we saw in this last year that there are actions the executive branch took that were highly disruptive. Is there an agenda here not only for keeping the pie as big as possible, but how is it implemented? So I think those are two areas where, yes, I'm worried, but there potentially are opportunities, and if we're not there, somebody else will be. So thank you for the question.
Thank you, John. Nakatha.
Yeah, I see a silver lining in some places. I see clarity. Um, we will get clarity in many places because we'll start thinking about our purpose as organizations and why we exist, because we will not be following the funding anymore. We have to follow our missions. I see courage because we have to talk truth to power. We have to talk truth to each other. We have to think about where do we go. So I see courage, those of us that are doing this work, and because we have said it many times, we faith organizations are not projects. We are organizations that are founded on missions that live beyond the money. So I see courage in people carrying their missions beyond the money. And then lastly, I see change, necessary change that is going to come. It might be hard, but we as the church have been through this many times, and I'm sure at the end of the day, we will see some good things coming out of it. Yeah.
Thank you so much, Nakatha and Sister Mary.
So, Michelle, you brought up earlier about the civil rights movement, and I think where I see the silver lining today is in a similar fashion where people are starting to take to the streets and speak out, where not just in the United States, but around the world, we're seeing people speaking to power and really rising up. And to me, that when people are complacent, that is when I'm most concerned. But when people are active and engaged and speaking out, there's hope there, and that's the silver lining for me. I also want to say that I think it's interesting when you speak about, how do we work with the current administration, or how do we work with others that we may not be on the same page. I think we have to do that. It's Jesus was criticized for having dinner with the tax collectors, right? Get over ourselves. It's not about who we like or who we don't like. It's about what we need to do collectively. And I'll end with this. It was a theologian, I believe it was Brian Massengale, who made the comment that the church doesn't have a mission. The church is mission. And I think it's imperative that what we see right now is this very time is when the church is most needed. And we were made for this time. And I think it's calling to us to speak truth to power and also to ensure that the gospel message is integral to all that we do.
With that, I want to thank each of our panelists, Sister Mary, Nakatha Njiru, and John Monahan, for joining us today for our United for Change, a Catholic response to today's global health challenges. And I'll end on a note from our three Catholic cardinals who issued that rare joint statement. Their concluding lines were this: our nation's debate on the moral foundation for American policy is beset by polarization, partisanship, and narrow economic and social interests. Pope Leo has given us the prism through which to raise it to a much higher level. We will preach, teach, and advocate in the coming months to make that higher level possible. Thank you all for joining us as panelists and also our guests that tuned in. Please join us at the O'Neill Institute for further webinars and programming this year and into the future. Thank you all.